premier office, I got to interview the premier doctor. Dr. Ronnie, thank you so much for being here today. I appreciate you.
Hello, Simone. Really a pleasure to be here.
Thank you for letting me into your home. This practice that you have built is amazing. You got to tell me, how did you even get to dentistry? Where did you even decide, like, in the brain, like, you know what, I'm going to become a dentist? Walk me all the way back through that process.
Wow. Actually, I graduated back in 1992.
Wow,
yeah.
okay.
And after working with the government service, we called it, for about 2 years, I joined the practice and as an associate for about 6 years.
Okay.
And then after that, I started in group practice with my partner. So I'm very big on vision and mission, and I enjoy reading a lot about outside dentistry. So from right in the early days, we were quite clear what we wanted to have. Because I was lucky the first practice that I joined. I think the first practice a dentist joined is really important because it really sets what they call the way you practice dentistry. And I was very fortunate in the sense that it was a very progressive practice. And I learned lots of things there and really thinking out of the box and thinking just beyond your training. And then so when we started our practice, it was we played safe because the both of us were kind of like really simple folks in that sense.
Okay.
Yeah. So we started what we call like a heartland practice in the area where we were opening 9 to 9 every day.
9 to 9?
Yeah, including Saturdays. And then Sundays was 9 to 5.
You're kidding.
Yeah, no. So for the first 2 years, I was actually working.
Were you married at the time?
I was, and a very understanding one.
Your wife is so understanding. Oh my God.
Yeah. But I think in Asia probably it's a bit different in that sense. And when you first start your own business, you just need to do whatever it takes to make sure it gets going.
And you did.
And we did. And after about a year and a half, we started sort of building up the pool of patients. And then we started getting associates in. And then after about 7 years, then we decided that we wanted to open a city practice, which you are here right now. So the city practice started in 2007.
Okay.
Yeah, and that was actually next door in the other office. And then we were there for 9 years, and then we moved over here. Yeah, so here now I think you had a tour of the place.
Gorgeous office. I have to commend you. Like literally when I walked in, I said, all right, guys, and you'll see a tour of this, but this practice is top tier. You've done an amazing job. Really, really aesthetically driven. It's high and advanced technology. I'm seeing pieces of equipment. I'm like, what is that? It's amazing. So you have a couple more offices, you said, right?
Yeah, so we have 2 brands. So the practice we started is still there. So that's in what we call in the heartlands where most of the population are staying.
Okay.
And it's still open 9 to 9. Yeah, and my doctors, they don't work as hard, but they still work quite hard in that sense.
Are they fighting with you?
They do shifts, do shifts and all that. And there is more of a family practice. They do a wide range of work. And so there are 16 dentists that move around between 4 practices. And then here at our city practice, there's 6 of us, 6 dentists, and we have 4 hygienists and 12 chairs. Yeah.
So as an entrepreneur to another entrepreneur, I gotta commend you because that's a lot of people and a lot of bodies. And I really want to get to know how you developed all of this because let's be clear, that's not easy. Before I even get started on that, one of my favorite segments is what you drinking. So what we do is we talk about what do you drink or what do you do to participate after work to decompress? How do you relax yourself?
I do drink, but not much.
Okay.
Favorite poison is probably red wine.
Okay.
And occasionally a bit of brandy.
Okay, nice. Do you do anything outside of the practice that's not related to alcohol to decompress?
Okay, to decompress, I exercise, of course.
Okay.
Yeah, I enjoy jump roping, actually.
Really? Okay.
I took it up during COVID.
Okay.
Yeah. And I'll be turning 55 next year.
You look amazing.
Thank you. Yeah. So I wanted to pick up something that, some hand-eye coordination. Of course, I've been running for years.
Okay.
Yeah.
So do you double dutch too? Do you can you
a little bit here and there?
That's awesome. That's awesome. So you work out, you drink a little red wine every now and again. Do you travel at all or see?
I do travel quite a bit. Yeah, before COVID, of course. And then, in fact, end of this month, I'm going to visit my kids in Australia.
Nice.
Yeah,
okay.
My son is doing dentistry actually. Yeah.
So you
but,
convinced
yeah.
convinced
No,
your...
he convinced me that he wanted to do dentistry.
Did
So I
you
said,
tell him like, no, like...
No. I mean, they have their own lives.
Yeah.
And dentistry is tough,
It's tough.
So I think you have to be mentally prepared. Yeah.
Yeah.
It's a long grind.
Yeah.
It's a
How
long
did you
grind.
find out that you wanted to be a dentist?
For myself, I think being in Asia, that was almost like 30 years ago, right? It's like everyone wants to be a doctor. Yeah, but of course not all of us get a chance to get into medicine.
Yeah.
And then I was offered dentistry and I said, okay, why not? Seemed to me like regular hours.
Seemed, right?
Less stress maybe.
It seemed, right?
It's like only 32 teeth, right? What else could happen? Yeah. But I'm just so glad I did dentistry. I think it's the best thing that could have happened.
I love that.
Yeah,
I love
for sure.
that.
Yeah, I just love my work and I'm really I feel a lot of gratitude, that I enjoy my work and I get paid for doing things that I enjoy.
Yeah. Well, let's go ahead and get into the episode. I want to talk to you a little bit about how you built this amazing practice, but now, how did you build like 5 amazing practices? You have 4 in the Heartland.
I think, we started slowly, of course, and I mean, to me, we knew from the start that we wanted a group practice because the way dentistry was heading, the equipment, the radiographs machine, and then we knew that things like laser and all, they cost a lot. So, and we also felt that can be very lonely as a dentist. Yeah, so we wanted to have a group practice where we could come together, support each other, learn from each other. So right from the beginning, we had a vision of setting up a practice where we could do really good dentistry and really good support. And we always felt that financially the money should come.
Yeah.
I think as long as you do good dentistry, take care of the patients, patients will take care of you as well. And it wasn't about building an empire or a large practice, but just enough so that we get good fellowship. We never really aggressively recruited dentists. Just along the way, people we knew, and then sometimes people just knock on the door. So we grew quite organically over the last 23 years.
And your doctor said that you also worked at the school as well. So like you guys were mentors there?
Yeah, we were both teaching part-time, Jerry and myself. Yeah, so Jerry's my partner. So we've been in the same business for about 23 years.
How did you find that partner? Because that's a marriage, right?
Yeah, they always joke some marriages don't last as well.
They don't.
I think I'm lucky because he has a philosophy of putting the company first and putting the other people's first. So whatever decision that we make is not to benefit the founders, but it's to benefit the rest first. Any decision we make, how it's going to affect the patients, how it's going to affect our colleagues, and then in the end, of course, how it's going to affect us at the same time. Yeah.
I love that. So in one sentence, describe what your core philosophy is about your practices.
I think core philosophy is not just doing things right, it's doing the right thing. I think that's really important, and that's one of the driving, I always tell that to my colleagues and all that. So you can prep the perfect crown, but does the patient really need the crown? You know what I mean? Yeah.
I love that. I love that because so many times in dentistry, people probably do things that just because they want a paycheck, or sometimes they don't practice and care about the person first. And
that's right.
One of my mentors, the very first thing that he would always tell me is, Simone, remember, there's a person attached to the tooth, right?
That's right. I mean, you never get a first molar walking it by yourself.
It's literally a human attached to that.
Exactly.
And when you can practice like that, when you love the patients, and I tell my associates the same thing, I want you to treat them just like they're your mom, that's your sister, that's your aunt in that chair, because for me that matters, right? It matters that those patients feel like they're family. They'll send more people through the door.
Exactly. And I always say dentistry is not a sprint, it's actually a marathon.
It is.
So if you want to do big cases like implants, makeovers and all that, I mean, of course you can do marketing and other things to get in the patients, but if you're in it for the long run, it's really what they call the trust and the referrals, So in the end, despite all the social media and all that, it helps a lot. But I think the trust, you can also build that on social media, but the trust building is the one that's important. And if you have that as the core philosophy of the practice, if you definitely filter through. Yeah.
And I also think that the team that you have behind you sees that, right? Because if they see that you're prescribing or doing things to patients,
the team knows exactly what's happening.
they know, they know when that crown didn't see right and you just let that patient go out the door. They also know that patient that didn't need that work. So I think in order to build a great team around you as well as patients, like what you said is great. And I think that line is perfect. I'm going to steal that.
Yeah, sure.
I'll keep it. I'll say that I said it though, right? So my next question to you is that what would you say are your non-negotiables in establishing a successful dental practice? What are the things that you say they have to happen this way and I will not negotiate if they don't?
Well, I mean, for us, we always try to give what the patient wants, to a certain extent. I mean, non-negotiable definitely in terms of all new patients, we want to take records, full records. You know? So, because when I started 30 years ago, I mean, there were still not enough dentists in this country, and the way we practice dentistry was very different. You know, it was really a needs space. When you come in, that's the problem. So for us, after some training that we did, we wanted to be really comprehensive dentistry. Yeah, so every patient that comes in, we started this about 20 years ago. So we do a comprehensive exam, which was less heard of back then than now. Because now, I mean, dentistry has advanced so much more. So I mean, having a comprehensive approach is getting quite common now in a lot of practices. Yeah. So taking photographs is something that wasn't done back then, but even back then, 20 years ago, we insisted every patient comes in, have a full series of photos.
And how was that for the patients? Were they resistant to that?
I think it's the way you prepare the patient. Yeah. So I think you prep the patient well enough, it's not a problem. I mean, most patients are quite clueless. You know, when they come to the clinic, the good patients, especially the patients you want to see, they will normally do what you tell them to do. And if they don't, then maybe you might not be the right patient for your practice. Yeah.
Yeah, I think for us, non-negotiables were definitely x-rays for sure. And I would say to my patients, you wouldn't go to a heart surgeon and just let them start operating, right? So it's important for me to be able to see the whole picture. And then another thing is that I didn't take records from other doctors as well, because now I have to be responsible for someone else's records that may or may not be correct.
That's right.
Yeah, so I used to think that was one of my big things. The other thing is that the team-centric practice was so important to me. And I still to this day feel like I can't do my job unless my assistants do their job.
For sure.
Right.
It's a team approach.
It's a team approach. And I think that doctors, a lot of times, they put themselves on this pedestal of, I have this title. And I'm like, no, you can't do your job if someone's not answering the phone, right? Because you can't be there, right?
Yeah.
You can't do your job if the hygienist isn't doing their job.
Yeah.
So I used to really have this perspective of, my title does not make me important. What makes me important is that the patients come through the door and they want to see a service from me.
Yeah, that's right. It's really how the whole team makes the patients feel.
Absolutely.
Yeah, we are just part of the chain.
We're
not that critical actually.
Yeah. It's like everybody is linked up. The moment that chain breaks, it's a weaker chain.
Yeah,
so,
right.
My next question.
And just to add on to that, I mean, the more comprehensive work you do, the bigger the case, the more important is the team.
Oh, right.
Yeah, they're just doing like drills and fills, then you can feel like, hey, I'm the boss. Yeah, but when you start doing full mouth dentistry, you are just, everyone else is your boss. Everyone is important. You need everyone else.
I completely agree. Yes. So everybody who is just drilling and filling, you got to check your ego at the door, because it's a whole team approach.
Yeah. No egos.
No egos.
Yeah.
And I think that dentistry has I don't know what it was like for you in school, but for me, it felt very egotistical. It felt very much so like this air of
doctor.
I'm a doctor. And then our school was even so they were so arrogant. I hate to say this, but when we graduated from dental school, you work hard for that degree.
Yeah.
You want to hear that name doctor, because you put so much blood and sweat and tears. They wouldn't even call us doctors when we walked across the stage.
Yeah.
And I remember being like, this is such an ego-driven thing. Even to when I'm finished, you still don't see me as an equal. It's crazy. So, but I digress. So the next question I have for you is that many dentists are trained in dentistry, but not necessarily trained in business management. So how did you go about learning your business management skills?
The hard way.
Falling and picking back up, right?
I think the two big areas that dentists generally tend to ignore is business and communication. Yeah, I think both are equally as important if you have your own practice.
Yeah.
If not, then the communication part is a lot more, because I always talk to young graduates and I tell them, how much time do you spend talking to patients? They say, 5%, 10% of the time. And I say, okay, so how much of your CDE or your continuing education budget do you allocate to communication? And usually it's like 0, or most dentists I know here, especially in this part of the world, we are not exposed to communication courses. Yeah, unlike maybe in the West, in Australia or in the US, they have a lot more maturity in that market.
Why do you think that is?
I think dentistry started off a lot earlier there, and then I think with time, competition, I think there's more dentists. I mean, the availability of care is higher in the US and maybe in Australia. So after a while, as dentists, you start to realize that, hey, I need to improve, I need to go beyond. And so that's when they always say, right, when the student is ready, the teacher appears. So I think then all these management consultants started coming in. Yeah.
So I agree with you wholeheartedly. What I noticed that dentists don't learn is we don't learn business management skills even in the West, right? So you fail.
Yeah.
Multiple times.
Yeah.
I mean, I can't begin to tell you how many millions of dollars I have truly lost by making the dumbest mistakes, right? When I first got out of school, the first thing that I did was I got the loan, and I bought a car with my loan money. This is how stupid because you're just like, I want to be this doctor, I'm this big old doctor, and I need to have a fancy car to go with it. Like, terrible business management skills. It wasn't until afterwards I was like, wait a minute, that wasn't so smart. I had to learn how to become a businesswoman because of the fact that I have a business, and now you have a multi-million-dollar business and you don't know how to run it, right?
That's right.
What are some of the things that you feel like doctors have to take as far as classes or courses to become more proficient in business management?
I remember about maybe 15, 20 years ago, I read this book called The E-Myth. Have you heard of that?
Yes.
Yeah. So I think that's a good place to start if you want to be exposed. So I think he wrote it for the physician. But basically what he's saying, that doesn't mean you can cook well, you can have a profitable restaurant. Yeah. So doesn't mean you have good side chair manners as a dentist.
Yeah.
That doesn't translate into a successful dental practice. Because things like finance, things like management, marketing, accounts, lead creation and all that. So there's so much to a business, and we are having a business. And over time, because cost has gone up, rental, staff costing. So I think all the more we need to. And gone are the days where as a dentist you just open the practice and everything goes. I think those days are gone.
So, as having an amazing dental office, what are your non-negotiables that you feel like you need to have in this practice in order for it to be successful?
I think definitely a well-trained team. That's probably the most important, the foundation of the practice. Then in terms of, let's say, equipment, definitely the intraoral camera, or rather extraoral cameras. We use SLRs. And then all the radiographs, CBCT, lasers are also quite essential in intraoral scanners, for soft tissue management of all your indirect restorations.
Do you see a lot of dentists being kind of resistant to moving towards technology? Because in the States, that is a thing.
I think interesting thing about dentistry is that I've traveled quite a bit, fortunate enough, and every country is very similar. So you have the really progressive dentists who are on the cutting edge, and then you have the rest who are like conservative.
You're like,
So I think it's not just in dentistry. I think it's just in as a whole. Most human beings, the way we think, you always have the early adopters, and then the laggards, and then the rest that comes along the way. So I mean, of course, being the cutting edge, you might be on the bleeding edge. You have to be very careful to be an early adopter. But for us, it's always been a bit of trying a bit of common sense as well when you want to buy something new. They always mention ROI. I think that's important and a good guideline. But some things you can't just purely ROI. Because certain tools just help you enjoy dentistry a lot more. And I think that's a good ROI for me in that sense, and not necessarily the business. So I think the lens that you look at things, if you just look at, if you only have one lens and the lens is financial, then everything is just going to be money, money, money. So that limits you. And I think the more lenses you have to look at the world or at dentistry, I think the better you are, and I think the happier you are actually, because you can start to see not just the monetary benefits of what you're doing, but all the other emotional benefits and things that happen to your patients, to yourself, and to the team.
Yeah, I like that, Dr. Ronnie, because one of the things that I think about earlier in my career was a lot of decisions were made financially, right? You're so strapped, so tight because you're overwhelmed by the burden that it is to be a dentist, right? Yeah. And these things aren't cheap. You have how many scanners here in the office? That's a Mercedes Benz. It's like every time I look at that, I'm like, this is driving an expensive vehicle, so it's not cheap, right?
That's right.
But I love what you just said about really considering dentistry in the lens of not just financial, but like how does it feed your spirit? How does it feed your soul? Because you are in this field to create smiles. You are in this field to create some amazing things going on, and you can't just look at about how much it costs you, but how does it make you feel when you come to work every day? When I look at the Mercedes Benz that I'm scanning people with, to see their aha moments when they're seeing their smile, when they're seeing the tartar buildup and the wear facets that are just shown on a scanner, the cavities that I can see clear as day in my loops, but they have no idea are happening in their mouth. It makes a big difference. Yeah, I agree with that. So my next question to you is that how has how has the definition of a thriving practice evolved in the last decade? Because dentistry is very different than it was 10 years ago. And especially with the pandemic happening and then it changing again, what was thriving then and what's thriving now?
I mean, I remember 10, 15 years ago, I was saying, that's the golden age of dentistry, right? When implants started coming in and all that. But now I feel, we're still in the golden age. And in fact, there's a lot more to come. And I feel really fortunate to be a dentist at this time. But we really need to open our eyes and open our hearts in the sense that, and not just look at just the 32 teeth or the 28 teeth, because I think dentistry has evolved into, I would say, wellness, into prevention, and I think the next big thing is of course airway dentistry. Yeah, I think that's one area where it's really going to benefit a lot of our patients, and we need to start young, as soon as possible.
Yeah. Do you follow any different type of philosophies now that you're doing a lot of Invisalign with airway? Because I mean, again, that's like opening up the palate and kind of giving us a space to grow breath.
Yeah.
Do you look at it when you're doing dentistry that way? Like you're like, okay.
For sure. So in terms of the dentistry that I do, so is it airway neutral? Is it airway positive, or is it airway negative? Yeah. So if it's airway negative, then maybe we shouldn't even go there. Yeah, because once you know something, you can't unknow or undo it, and it's doing the right thing. So it's either airway neutral or airway positive, and it really depends on the patient. You need to educate them. And of course, if you do airway positive, it's definitely going to be a bit harder, a bit more work, and the cost is a bit more. But the benefits to the patient, it's tremendous.
It's significant,
Yeah, and then, there's nothing wrong doing airway neutral dentistry because you're just keeping the patient where they are.
Stabilize,
Yeah, and then, of course, I think as dentists, it's our role to know that, not to do airway negative dentistry. Yeah, I think that's important.
So, like, for the people that you're trying to educate about airways, that's a great example. Like, and they're not interested in hearing. They have no idea what you're talking about.
Yeah,
they're
that's
like,
right. Yeah.
What is this? Like, I'm not giving you any more money to do anything. How do you overcome those barriers, those obstacles that can be kind of like, hey, this is going to be the best for this patient.
Yeah.
But they're not there yet. The world hasn't gotten there yet.
Yeah. So. No, we always, patients arrive at your practice with, we call it mental baggage, right?
Yeah.
They're carrying stuff, their loan, their mortgages, and things like that. And the last thing you want to do is to give them another emotional.
Here's another bag.
Yeah. So I think in the end, rapport is the most important, getting the rapport with the patient. And then you just need to go smaller steps, just explain to them, give them educate them and give them the opportunity to either say yes or no.
Yeah.
And try to dumb it down to make it simple. And then so give them the two choices, and if sometimes they're not ready, so that's where you can sort of take a step back, do something more basic first, and then, when they're ready, they'll do it.
You mentioned something earlier about learning communication styles, and I think that that's something that you have. I can already tell have an amazing strength at. You know, the way that you use words and you adapt it towards the environment is important. I think that's probably been very successful in your career as far as growing your practice, not only for your patients but for your team. Right? Talk a little bit about your journey as far as leadership and how did you develop yourself as an entrepreneur in leadership as a dentist?
Oh, wow.
Yeah.
I guess some of it was from reading, reading books outside dentistry, going for courses, practice consultants and communication courses, some for dentistry and some outside dentistry as well. Yeah, I think we really need to look beyond that because the dental school is really to impart clinical skills. I don't think dental schools have time to talk about communications or business, although I think it's changing. Yeah, I think it's changing. So it really is up to the dentist to realize that, doesn't mean that we have a mouth, we can communicate well. Yeah.
That is totally true. Just because you got teeth doesn't mean that you're saying the right thing.
Yeah, that's right. Yeah.
Yeah. For me, I really struggled with leadership when I first came out as a dentist because, again, like you said, we're not taught that. And I remember seeing turnover of my team happening and just being like either frustrated because I'm like, I need you to see this vision. And then what I realized was a couple of things. One, I wasn't clearly articulating the vision because I didn't have the communication skills. And sometimes you just don't know what you don't know, right? Like you're creating the vision, but it's ever evolving. There's a struggle there. But then I also realized that just because I had the title as a dentist didn't mean that I was a leader. And so for me, I took a whole year of just deciding on how to be a better leader, whether it was reading books, taking courses that were nothing related to dentistry, but everything related to growing as a person.
Yeah.
The other thing that I think helped me was travel. Like even coming here, right? Being in Singapore, I'm a bazillion miles away from Houston, Texas. What I realized was my ability to connect to other people, right? And understanding how to connect to other races, other genders, ethnicities, all the things made me a better communicator. And I was able to come back and have a different lens to lead my team. One of the things I wonder for you is that how have you, as you've now developed a great leader, clearly you've been very successful, kept your team motivated, still learning, right? Always learning. Been able to keep your team inspired and leading your team. Like, what are the tips that you would give to any other doctor about how to lead a team? Because this is, how many people do you have on your whole squad? Like, this is like a lot of people.
I think what you mentioned earlier about articulating your vision, I think that's very important. You cannot repeat that enough. They need to understand where you're going and what you're heading and why. I mean, why are you doing this? I think everything that the task that they are doing, they need to know why they are doing that and how it benefits the patient. So I think once they know that, it's a lot easier and not just doing it for the sake of doing it or for. I mean, of course, everyone works for a wage, but it's not just doing it for the money. I think there's a bigger reason of doing the things that they do. So I think everyone is motivated by a higher calling or doing something more than just for the sake of doing something. Yeah.
Have you noticed a difference in the pandemic of the working force versus pre-pandemic?
It's a lot harder to hire for sure. Yeah, I think definitely hiring, and I think the pandemic has everyone sort of rearranging their priorities as well. I mean, I think for the service industry, it has really been a big challenge, not just for dentists, but I think the service industry as a whole.
Yeah, for me, it's been a struggle as far as keeping people that, I think that, like you said, it's not just about the paycheck. You gotta be about the purpose, you know, like what do you see the vision and do you accept that? But I think that because the pandemic changed everybody's mindset about what they felt was purposeful, right? I want to say there's instability there still. Like it feels like people are still trying to figure out what they want even after that period. So we've struggled a lot in the States with trying to find really great people to really want to work and cultivate in our practices. And then the biggest struggle has been hygienists. I don't know if that's been like that for you guys, but for us, hygienists have been like, I mean, it is tough.
So the concept of hygienist was a bit newer here. You know,
Okay.
I think just the hygiene school started, if not mistaken, maybe about 15 years ago, in terms
Okay.
of 15, 20 years ago, in generating hygienists for the private practice. So all along, the hygienists were trained for the public, and they used to be sent to the primary schools. Yeah, so,
Oh,
so even
wow.
until now, I would say probably 50%, maybe more, of dentists do not use hygienists in their practice.
Okay.
Yeah.
So how does the hygiene care work then here?
So most dentists do the hygiene. Yeah,
Wow,
most
and
dentists do
also the
hygiene.
restorative too.
Yeah, that's right.
So that's limiting to then how much they can produce, right?
Exactly. Yeah, and because of real estate is very expensive here, because we're a little island state, so it's quite costly to have, let's say, an extra chair for hygienists. So from the business point of view, in most group practices, with the extra chair, they would rather have a dentist than a hygienist in that
Wow.
sense. So maybe in bigger practices like this, we are in an office building where the overall rent will be lower.
And you could support
Yeah,
it.
maybe we
Yeah.
can support having hygienists. Yeah.
Wow. I love talking to someone
Yeah.
from a different place because I'm like, that's totally different for us.
Mhm.
So my next question is that how do you ensure that business aspect doesn't compromise your patient care?
Well, I think as dentists, each of us are a professional, you know. So there's only so much we can set a standard for our associates. Yeah, I mean for ourselves, it's actually pretty straightforward within me and my so-called closer partners, in the sense that the business part is very real, which is why I mentioned the communication. And the patient knows that when they come in, you know, they always have a slight suspicion, you know, or what's going to happen. So I think letting the patient know upfront, you know, why you are there, you know, introducing yourself and telling them your philosophy of practice is really important. And then number two, I think having good photography and showing the patient exactly what's happening in their mouth, that also so really important. And then after that, thirdly, will be then giving the patient options.
Yeah.
And then I always tell them you can always extract the tooth. I mean, that's what used to be done in the past.
Yeah.
And you know, millions in the world do not have teeth, and life goes on.
Yeah.
You know, but of course, some of us do like to keep their tooth. If we want to, then we can do that. And some of us feel that the smile is very important.
Yeah.
And if we want to know what we can do for you to improve the smile, we can. But if you're perfectly happy with the smile, then there's no need to do anything, right? Yeah.
I try to tell them, listen, like for my patients, I'm like, the years of neglect isn't a thing on me, but what I will do is help you feel much better if we go ahead and get this repaired, right? So what I think doctors sometimes feel is that they're responsible for what's going on in the patient's mouth. And I'm like, well, no, that's not necessarily.
No, yeah. That's called owning the problem.
Yeah.
And so lots of dentists tend to own the patient's problem.
Yeah.
And then the key to me, you know, when I learned how to reverse that and sort of give the problem back to the patient.
Right.
That was the day I really started enjoying dentistry a lot more.
Yeah, I
Yeah.
agree with that the same. It was like where I'm like, you know what, like, hey, my job here, I'm here to help. And I always tell patients, I'm not going to become rich off of just you. Like, this is not how this works, right? There's not enough money in your mouth to make me rich. What I can do is that I want to make sure, like, for me, I got into dentistry because my father grew up very poor. He lost his teeth really early, and I got a chance to see him losing his teeth, and I thought it was the coolest thing ever. I didn't know he was losing his teeth because he grew up poor. I just was like, I'm going to see my dad get a tooth pulled today. This is exciting. Not like, oh my God, he should not be losing teeth, right?
Yeah.
And so for me, it's like, I want to make sure that my friend's dad isn't losing their teeth and their kids aren't losing their teeth. And so how do I continue to be a beacon of light? To me, that's not business. That's just me being a good human, making sure that I'm taking care of teeth, right? And so I love that you're talking about, at the end of the day, if you care for your patients and you care for your team, everything else kind of works itself out, right? So a couple other questions I have is that with the changing landscape of healthcare and dentistry, what advice would you give to someone looking to start their dental practice today?
Wow. I think it's definitely increasingly harder to start a solo practice, for sure. You know what I mean? So I think most new practices I see are all group practices. So in that sense, probably the most important is finding like-mindedness, people to start the business with, you know. Or of course you can join the existing group and see whether you can have equity in it. Yeah, but dentistry has changed so much.
So much.
Yeah, so I think in certain countries it may not be even possible to open your own practice anymore because there's too much competition and the cost is too high.
Yeah.
Yeah.
I opened my own office by myself for 14 years, and I still to this day think about how hard it was because you become the HR person, you're the marketer, you're doing the dentistry, and I feel like my brain was on fire all the time. I just sold it like maybe a year and a half ago, and I'm to a group practice. But then the flip side of that is that it's like those corporations that don't love your practice like you love it. And so then that's another thing where you see yourself kind of like being inflamed or just like, I don't know which one is the right answer. I think the way you went about it was really smart because you were able to divvy up the responsibilities. It wasn't just you doing everything, it was you and your partner being able to take on the journey. Yeah. So I have to agree with you when I think about practices now on their own. I'm like, I don't even know how I survived doing it that long. It's really tough. Yeah. I have one more question that I would like to say is where do you see the future of dentistry heading and how should new practitioners prepare for it?
Well, I wish I had a crystal ball. Yeah, but I think definitely the trend will be towards bigger group practices. I think that's something that cannot be helped. And I think that's good also for some of the younger doctors, which I see graduating. I think they come out with a different lens, different perspective on life. They want so-called more balanced life in a sense. Whereas for my generation, it's a bit different, and then yours is like kind of like in between.
Right.
Yeah. So definitely heading towards bigger group practices for sure. I think more technology, without a doubt. I think airway is going to be big as we go forward.
Well, Doc, I want to thank you so much for your time being here. You have built something amazing, and I think that doctors, especially when we see the magnitude of that, sometimes we don't celebrate ourselves. So I hope that you take the moment to just celebrate yourself as well as your partner because this is a really big deal. And as an entrepreneur who sees all the things that go on behind the scenes, I think you've done an amazing job. I'm inspired, and I want you to continue to push forward because I see the doctors that you have in here and the doctors that you're going to continue to touch, and that's a really big deal. So, Doc, thank you so much for allowing me in your space. I am grateful for it, and I also am just thankful that I got a chance to spend time with you today.
Pleasure is ours.
Thank you.
Yeah.
So guys, this is Beyond the Chair. Be sure to subscribe, like, and follow our podcast. We want to hear what you guys like, what you don't like. And then also I want to hear your reviews. So please be sure to write a review and let us know how you like this episode. Guys, this is Beyond the Chair. We'll see you soon.